All right. It is 5 o'clock on Saturday. We're very close to Mother's Day, so happy Mother's Day to all the moms out there. Happy Mother's Day to my mom, Jane Beshear. Happy Mother's Day to my wife, Brittany Beshear, and to everybody else out there, especially during this time. Happy Mother's Day. Let's start the way we always start, by remembering and saying that we will get through this. We will get through this together. Say it with me and believe it. We need it every day. We need to make sure that we continue to lift ourselves up so that we can move forward. We will get through this. We will get through this together. One last time. We will get through this. We will get through this together. So I'm helped today by Rachel. Thank you, Rachel, as well as Greg. He is not new, but he's just the last about month on the slides. And then we always have Kenneth at home. We're going to get through this because, again, we're going to remember that as long as we can live our lives in the near term until we have a vaccine by a few simple rules, then we can defeat this coronavirus. It doesn't have to be complicated. We've put it in the top 10 rules to defeat the coronavirus. And, we've talked a lot about different parts of it. We're just going to take one or two over time. I want to take today prioritizing your mental health. So tomorrow we're going to be off. We're going to be enjoying Mother's Day. Make sure you do things that enrich your lives, make you feel better, because, again, this is a worldwide pandemic that's not going to go away overnight. And we've at least seen signs after several months that some are kind of restless and maybe want to pretend like the virus isn't out there. Protecting your mental health, prioritizing it, staying healthy, finding ways to find joy, to get exercise, to stay challenged will help you to have that resilience and that perseverance. But part of it is being willing to be vulnerable and to talk about when you need a little bit of help. It's not been easy for me, and I know it's not been easy for you. Everything from my daughter blaming me for school not being in person for the rest of the year. She's an amazing daughter, but understandably, I have to make that recommendation to just the uncertainty and the anxiety and waiting on the numbers every day, and waiting on the number of deaths every day. That hits your mental health, and wondering about our decisions that we make. And as we transition to other things, what we'll see, knowing that those decisions can be decisions of life or death, that hits your mental health. It certainly hits mine. So take care of yourself, please. And when you need to shut it off, shut it off. When you need to not watch at 5, I understand. I do. So take care of yourself. Take care of other people. Ask each other how you're doing. Nobody's doing okay. We all know that. But let's try to lift each other up a little bit too. So we always talk about the top 10 rules plus one. Fill out your census. We need you to do it. It's incredibly important. We'll talk a little bit more about it tomorrow when we can get a bigger update. And then we ask you to model the type of behavior that we need to see to stay safe. A lot of what we're doing right now is about everybody being willing to do what it takes to defeat this virus, which means we need that encouragement to folks that are struggling. We need the encouragement to our neighbors around us just to keep them strong and make sure that they're doing the right things too. So we've always been using Team Kentucky, Together Kentucky. We've been using #Patriot because it is your duty during this pandemic as a citizen of the Commonwealth and a patriotic American to make sure you don't spread this virus to other people and that you make sure you protect one another. #Healthy at home, and now healthy at work. And I really want our employers, our workers, to be using this one, because if we don't do this right, it will cause a surge. It will push us back. It will harm our economy. I know we're all worried about our economy, but what we're seeing right now is a short-term issue. If we can't transition back the right way, if we don't follow the rules, if we cause a spike that we could have avoided, that's what will harm our economy in the long term. The states that have the strongest economies won't be the ones that have the most or the least unemployment claims right now. They'll be the ones that can transition to work the best and not have those future spikes. So we want you to fill that up on social. And here's a little bit of what we have seen today. All right, again, Year of the Nurse. I think it's fair that this is the Year of the Nurse, and just seeing the good work that's being done by those that are on the front lines, their courage is astounding. So Family Scholar House is admittedly one of my favorite nonprofits. It builds futures for those that are struggling, takes many single parents that are homeless or transitioning between places, gives them a bright, solid future, and for their kids too. Their thanks for Teacher Appreciation Week, I think, is even more important. And the number of graduates that go from this to either teaching or healthcare, really says something. When somebody is willing to give you that extra help, you want to give back. And we see that in Family Scholar House. Thank you to Kathy Dykstra and everybody who works there. Crank and Boom. This is, again, delivering to so many different schools. Crank and Boom in Lexington, I hear they've got at least one great ice cream flavor. They've got a bunch. All right. This is the opportunity. Secretary Freelander talked about it the other day, that while we can't have direct face-to-face contact with our parents and grandparents, this is the opportunity to celebrate in a safe way these types of really important moments. And knowing until we have a vaccine, visitation is still going to be very difficult for our older population. It's very important that we are able to find these moments. I will tell you, the vast majority of fatalities in Kentucky are 60 years and up, which means, and we'll break it out, it means as we go forward and we have more contacts, it can be pretty deadly for a certain sector of folks, and we need to make sure that we're doing everything we can to protect them. All right, Nancy Combs from Somerset, ringing her bell, rain or shine, at 10 a.m. in her green hat and her green scarf, showing compassion, showing unity, showing what Team Kentucky is all about. Now, this is a pandemic that is going to take people that we love and care about, and making sure that people know they're not alone, and letting them know that we are unified is important each and every day. So let's keep it up. All right. So this is Danville and some of their government leaders. Again, just seeing how every community is lighting their homes and their office buildings, everything else up green, to show the compassion that we feel for those that are struggling or those that we have lost. Speaking of that, we got a video of Newport and a little bit of what they're doing. And it's hard to imagine being somebody going through losing a family member during this time. We're close to all knowing somebody that's been lost during this, but my belief is being able to drive around to see this and to see pictures of it, to see it online, again, is that hug that we can't give them right now. It's that chance to tell them that we're with them and we grieve with them as well. I want to talk a little bit now about where we are and our challenges ahead. And I think the best way to do that is to start where we started, by talking about Philadelphia versus St. Louis. We haven't shown it in a while, but remember, this was Philadelphia during the Spanish flu. This was the reason that we instituted the aggressive orders that we did, because without major steps, what you see in all of these are a large spike, and these are deaths that cause catastrophic loss of life. Let's show St. Louis. Now, we are closer to this. But I think we've done even better than this. Instead of kind of having a curve up, on the way up, we've plateaued. Going straight across instead of up. But this is still the world we live in. These pandemics do work this way. So remember, those that would say, let's end all the restrictions right now and go back to everything we used to do, we would go from St. Louis, where we are, to Philadelphia real quick. In fact, though we've lost now over 300 when we read it, one of the major modeling groups is saying if we lifted all restrictions, like some people are asking for, we'd lose 23,000 Kentuckians in the next 90 days. So this virus isn't gone. It's still out there, it's still dangerous, and we have to make sure that we are smart in how we address it and how we move forward. Show Louisville now, the third one. So our challenge, though, as we move forward, is to not let that second spike from St. Louis happen. Remember, they lost more people when they were coming out of it, when they thought they'd done a great job, at least compared to Philadelphia. You know, we've social distanced, we've saved people, and then they loosen up, they don't follow the new set of rules, and look what happens. That second spike would shut down our economy again. And more importantly than that, we would lose more Kentuckians. So our goal now, when we think about where we were, is, I know when we all started, let's not be Philadelphia, let's be St. Louis. Now, we know that we've done better than St. Louis. We want on the tail end to look more like Louisville from the Spanish flu. You know, we have cut the top off that muffin. We are at a plateau. What we want is it to go down, though it won't go down as dramatically, and stay down in a long, slow, diagonal line until this thing is gone. So when we're thinking about cost in terms of loss of life and our economy, it is absolutely critical now that we don't first of all, that we don't lift restrictions and get Philadelphia, that we don't let up or not follow the new rules and have that second part of St. Louis. Now is the time where we have got to make sure that we continue to do this, again, better than anybody ever has, and make sure that we rewrite history on these graphs so that the next time that there is a pandemic, which I hope is long after I'm gone, we are showing a new graph of how to do it, and that is Kentucky. I'll tell you what, before I get into the numbers, given where we are and haven't talked about this and where we need to go, I want to ask Dr. Stack to come up and give his thoughts.
Thank you, Governor. I want to be kind of serious tonight, but before I do that, because I do think it's important for us also to take a few minutes to enjoy what's good around us. The governor mentioned Crankenboom, so thank you. The flavor he was referring to was the one named after me. So I picked up my 3 pints today, and I think I surprised the young man who brought it out to me. So thank you very much, and for raising money in support of our first responders. Also, happy Mother's Day to everybody tomorrow. I hope you have a wonderful day. I did want to give 2 quick updates. One, I've been working with a lot of different entities. I'm just going to mention one right now, with the Purdue chicken plant that's in Ohio County. I'm very grateful for the open communication I've had with the leadership of Purdue. They did just a few days ago test the entire workforce, and they had a positivity rate of about 7.8% or so, which was not as bad as we thought it could be. They've taken a lot of steps there to try to reduce the risk in the plant, and I'm very grateful for the actions they've taken. They're also working with our local health department leaders across 3 different counties, as well as my team at the Kentucky Department of Public Health. What this shows, though, each time we do this, whether it is a nursing home or a prison, or whether it's a factory or some other place of work, it is very labor intensive. It takes a lot of people coming together to do a lot of work, which leads to the next message that the governor, I think, asked me to come up here and talk about. I've said over these last 2 months, as I've had the privilege to talk with you on a regular basis and to advise and serve for the governor repeatedly, I think we are trying to inspire people to do what needs to be done, to inspire people to do what is necessary to keep as many folks safe as we possibly can. When we went into this, using the modeling that we saw from China and from northern Italy, and then even what happened in New York, the models would have suggested that we could have had, over just a few month period, 45 to 90,000 Kentuckians die from coronavirus. Those are staggering numbers. We've already lost over 300 individuals to this. We could have been standing here today talking about tens of thousands of Kentuckians who had died from the coronavirus. And we have done a wonderful job as a state. We really have, like the governor showed on the St. Louis-Philadelphia graph, we have really cut the top off of the big peak. We've done a fantastic job. This is exactly when people start to get complacent, when people start to take for granted that the disease is still out there. I know it's out there because I'm talking to manufacturers and to nursing homes and to those who are responsible for prisons. The disease is out there, and when it hits the people most vulnerable, it's devastating. It's absolutely devastating. And so for those of you who are listening tonight, and for those you care about and you love, even as restrictions are lifted, because there are other things that society is demanding of us, even as restrictions are lifted, there has never been a time more important than now for you to do all the social distancing, to use universal masking when you're anywhere near anyone, and for you to follow the guidelines that we're working with industries to put out there to do everything we can to try to help keep people as safe as we possibly can. So I just continue to urge you, this is not the time to take this for granted. This is exactly the time when the weather gets nice and people start going outside and people are really tired of having to have these restrictions. This is exactly the time when I have to urge you, and we really need you to continue to pay attention to these guidelines and work with us on this so we can keep as many people safe as possible and not have some of the really bad consequences. Those just look like colored lines on a graph. Those lines are people's lives, and it's not fiction. This is reality. That really happened in the past. It's happened in New York. It's happened in Italy. It's happened around the world. We really, really have to make sure we pull together. So I'm proud of Team Kentucky. I'm grateful for the opportunity to serve, and thank you very much, Governor.
All right, let's go over our numbers for today, which again show a steadiness despite additional testing. Our numbers have certainly remained in that plateau. Today we're reporting a total number of new cases of 158, and our new number for total cases after our daily audit is 6,440, 6,440. Of those, 23 are probable, the rest are lab confirmed. Total number of tests, again, we're doing an audit on this because we know the number is higher than this, 86,900. Total number ever hospitalized, 1,757. Currently, 394. Ever in the ICU, 758. Currently, 226. We're watching this. This number is going up. We need to be thinking and caring for those 226, but something to watch as we continue to move forward. And our number, our favorite number, which is our number of people recovered, 2,308, and we're going to show you a video on that right now. So I'm going to tell this story while it goes. Jean and Elaine Hornback of Versailles reunited this week after more than a month apart. Jean was just discharged from Baptist Health Lexington after a tough fight with COVID-19. They will celebrate their 60th wedding anniversary on September the 16th. One of the last times they'd been together was on March 30th when they arrived in the same ambulance to the emergency room. Both were suffering flu-like symptoms. Both tested positive for COVID-19. Jean was admitted to the ICU. where he was placed on a ventilator for more than 3 weeks. Elaine had a milder case, was admitted on another floor. Elaine said the thing that gets you the worst is a weakness. It's like someone sticks a syringe in you and takes every bit of strength out of you, like nothing I've ever felt in all of my life. Even though they were separated by floors, Elaine said she could still feel her husband's presence close by. Dr. David Daugherty, the infectious disease physician treating Jean, would go to her room every day of her stay to update her on Jean. When the physician had a rare day off, one of his partners would update her. On April 25th, Elaine was discharged and moved to Cardinal Hill Rehabilitation Center. Meanwhile, with the hard work of his doctors, nurses, and therapists, Jean began a slow path to recovery. Mr. Hornback is a perfect example of a COVID-19 miracle, said Jenna, one of the nurses in his units. He had all the odds against him and still beat the virus. He is a reminder of why I became a nurse, and I will forever have a place for him in my heart. I'm proud of them, Jean said of the team who cared for him. They did a wonderful job. Prayers for them all. Elaine, who is back at home now, says she is getting stronger every day and looks forward to when her husband can be with her. She has a new purpose in life, Dawn Hornback Mulliken said of her mother. They're both looking at it like they've had the greatest gift given to them, which is more time together. Special moments, having both of my parents go through either cancer or cancer scares. I can feel a little bit of what that must be like to be their children. New cases by county, 31 in Jefferson, 27 in Fayette, 18 in Warren, 11 in Kenton, 11 in Logan, 7 in Boone, 5 in Jessamine and Shelby, 3 in Bullitt, Butler, and Ohio, 2 in Adair, Graves, Grayson, and Henderson, and 1 in Bath, Boyle, Callaway, Campbell, Davis, Franklin, Grant, Harrison, Henry, Hopkins, Johnson, Knox, Laurel, Madison, Marshall, Mason, McCracken, McCreary, Nelson, Oldham, and Todd. And recently, just to remind us, because it's good to have a reminder that this can impact everybody, of these new cases, they impact people of all ages, all ages. Actually, when you look at the breakdown of total cases, 34% of all of our cases, 30% of all of our cases are between 20 and 40 years old. So individuals between 20 and 40 years old make up 30% of all the COVID cases that we have had in Kentucky. When you look at 40 to 70, it's 46%. I'm in that range. And we don't consider that range old, but a significant portion of COVID cases fall within it. For those that think that this just hits people in their 70s and older, that's just about 19% of our cases. Yes, it's absolutely deadlier in the 60 and up population. I mean, a mortality of, I think, almost 27% when you look at that, but it's hitting everybody. And because, summer's coming and I know people want to do more, I just want to remind us that this is still out there. Today's results include an 18-year-old female from Boone, a 17-year-old male from McCreary, a 19-year-old male from Ohio, a 15-year-old male from Jefferson, a 21-year-old from Boone, a 23-year-old from Warren, a 23-year-old from Bullitt, a 23-year-old from Johnson, a 1-year-old child from Knox, a 12-year-old from Warren, and a 13-year-old from Jefferson. So, when I say I wear this to protect my kids, I mean it. This thing spreads everywhere to everyone and can cause complications to anyone and everyone. So let's not let our guard down. Let's make sure that we are doing the right things to protect one another. And the virus continues to be deadly. So today I'm reporting that we have lost 6 additional Kentuckians to COVID-19. They include a 63-year-old male from Jefferson, a 92-year-old female from Meade, And then 4 residents from Graves County, a 76-year-old male, a 95-year-old female, a 90-year-old female, and an 81-year-old male. So all those green lights we saw in those videos, let's keep it up. These are 6 more families that added to our others mean we've now lost over 300 Kentuckians. We've lost 304. So let's continue to honor those 304, and knowing that we're going to continue to deal with this virus till an effective treatment or a vaccine, let's keep showing that color of compassion, that we care about one another. We're going to do what it takes to protect one another, that there's a better day ahead of renewal, but that also for these individuals we've lost, they are headed to a better place. This is their renewal as well. So let's continue to shine those green lights. Let's continue to ring those bells at 10 a.m. every day. Race and ethnicity, on total number of cases, 74.4% white, 13.86% Black or African American, 6.23% Asian, 5.34% multiracial, and then it's 12.78% Hispanic and 87.22% non-Hispanic on ethnicity. On deaths, we see 78.15% white, 18.52% Black or African American, 2.22% Asian, 1.11% multiracial, and then on ethnicity, it's really right at 98% non-Hispanic and 2% Hispanic. So, you know, it's tragic that we continue to lose Kentuckians, but it's a very serious virus. We are fortunate through your good work, the citizens of Kentucky doing what it takes, that we have plateaued. We continue to be there, even with more tests every day. That's a good sign, but it doesn't mean the thing is gone. It just means that we're doing the right things, and we've proven that we're doing the right things, and that we are saving lives. Remember that COVID Act now is still saying the difference between us following the rules and doing the right thing and not is about 21,000 lives here in Kentucky. So let's keep it up. Let's be our brother and sister's keeper. Let's remember that part of living out our faith is doing what it takes to protect one another. All right. Let's talk about houses of worship really quickly. On Friday, we issued our guidance to churches on how to more safely hold in-person worship services starting on May the 20th. In light of recent court rulings, which allow in-person services to resume immediately, we'll be making the guidance effective for services starting today. I know some folks are ready to get back to in-person services, but we must remain vigilant, and we must make sure that any house of worship is ready. Even just the cleaning that's required is more significant than is done just about anywhere else. That every single surface has to be cleaned. What's really required in social distancing, some people want to say, oh, just sit 6 feet apart. It's so much more than that. It's forward, it's backwards, it's making sure only family units are together. It's making sure people enter socially distanced. It makes sure the people in the parking lot are socially distanced. So what I'd ask is people take your time. You don't want your house of worship to be a place where the coronavirus is spread, and we know it has. In Washington State, a choir practice resulted in 45 people infected and 2 people dead. South Korea, one service, 37 infected. In Arkansas, 34. In Sacramento, 71. In France, one major event, 2,500 they've reported. In Kentucky, over 50 cases, and we think up to 5 deaths. In Alabama, 14. Now, this thing spreads through other mass gatherings, mass meetings, and the like. All I'm saying is be careful. Make sure that you do it right. To every house of worship, go back when you're ready. But what I'm requesting and what we really need is, if you haven't read through all the guidance and you can't meet it, don't come back just to come back. Make sure that your sanctuary is just that, is a place of safety and comfort for those that are there. And remember that number I just threw out. We think the mortality rate can be 27% for those that have tested 60 years and up. And so be very careful about encouraging different folks to continue to worship virtually or worship through drive-in services. They are still safer. I know my church is not opening yet, and it's not going to open to in-person services until at least June. I support their decision. I want to go back. I really do. But what I really want is for the people in my congregation to be as safe as they possibly can be. So make sure we don't pressure those houses of worship. Let's make sure that we do everything that we can to support the good decisions that can be made. Testing. Let's put up where all of our testing is next week. Let me put in a plug for our Kroger sites. Next Tuesday, there are still about 150 spots in Corbin. The spots in Corbin are not filling up fast enough. This is an area where we need more tests, and there haven't been enough tests. Next Wednesday, there are 300 spots open in Corbin, and there are 450 next Thursday. So to all of our local leaders, to everybody out there, to anyone close by, to anyone who wants to drive an hour, you can sign up now. You can get that slot. Please do. When we look at Louisville, 250 slots next Thursday and almost 400 slots next Friday. Lexington, 300 next Thursday, 350 next Friday. E-Town has done a really good job all 3 days. You are maximizing that. We'll look at that. We'll look at how the area is serviced, and we'll see what we can do in the future. Thank you to that entire region for what you're doing. I mean, remember, we have got to get to a point where we're testing more than 2% of our population. We now have the capacity, and we're working on the delivery model. But unless people sign up and go to it, then we don't meet those numbers. So part of that is good citizenship. I'll give you an example that's Hazard at the primary care center. They were doing about 170 tests a day. They're down a lot. We need to keep going, keep signing up, and make sure that we get everybody through. All right, with that, we'll open it up to questions, and I think we're going to get out of here early today. We've got Shelby Lofton is back with us from WKYT. We have Morgan Watkins from the Courier-Journal. We have Karen Czar. Are you okay? I know you were in an accident coming over. You're good?
She was more stressed than I was.
All right. Your insurance will cover it. Reformed lawyer. And Eleanor Buckley from WLEX. So let's start with Shelby.
We have an elderly man, Mr. Spurlock, who calls our station every day, and he asks when he can visit his wife who's in the hospital again. He says every day it gets harder.
Yeah.
What would you say to Mr. Spurlock?
So the question is, Mr. Spurlock has a wife who's in the hospital, wants to visit her, elderly, and in the hospital, not a long-term care facility. We are working, and we are looking at the numbers to see when we can open up. Okay, it's this Wednesday. I'm going to ask Dr. Stack to come up and answer that question. If the answer is as simple as Wednesday, I'm glad we were able to give it.
So this Wednesday, I think that's the 13th. So in phase 3 and 4 of healthcare reopening, as people go back into hospitals to have inpatient procedures, we will allow for up to one or a single visitor per patient, subject to the hospital or healthcare facilities policies. So to be very clear, there is a visitor restriction still in effect for healthcare facilities, but at the discretion and at the policy of the hospital or healthcare facility, they can permit up to one visitor per patient. We never wanted to separate people from their loved ones. It was all a safety measure, but it'll change Wednesday.
And I take it, Dr. Stack, that'll be a little different on any COVID wing in a hospital, and different where the possibility of infection could cause serious and significant harm.
We'll be able to have policies at the
Okay.
hospital.
So hopefully there's more opportunity there. Karen?
As we wind down the second week of more medical opening, what's your overall assessment?
As we wind down the second week of opening up healthcare, we won't, again, you typically would see it 2 weeks out, but I'm generally pleased. I am pleased at where our numbers are. If you remove the Green River Day and account for how things roll in over the weekend, we are very steady in our overall numbers. But this is also the healthcare profession. The healthcare profession is the absolute best at knowing how to reduce the opportunity for contagion and spread. But we definitely need to revive that part of our economy because public health and healthcare is critical, especially now. So I believe that those coming back are doing a really good job, but we got to continue to watch and to be vigilant. Eleanor?
I know we're on track with kind of Ohio to open restaurants, but they are going to open bars before we are. Are you worried about, especially younger people, going up to Ohio to the bars?
The question is on bars opening earlier in other places. The challenge with bars is the social distancing. I mean, it's really hard to see how that would work in a regular bar until we get to the point where you can have 50 or more. It's also tough to understand how the economics would work if you were 10 or under or a certain part of the capacity. Those are important small businesses. Sometimes they are medium-sized businesses too. I read about a couple adding some food service, which is a good opportunity. And with food service, they could do outdoor seating as well. But this is just a virus where there are certain things that are a bigger challenge for us to figure out. And it doesn't mean that I don't think bars could do the cleaning or that their owners would try to do the right thing or that their employees would try to spread out and do the right thing. I just think it's a much harder environment to get the social distancing in. So we are looking at July in that. We do want to work with folks that are there. Just a real challenge.
Are you worried about people leaving the state, though, because of that?
I'm worried about people leaving the state at any time right now with other things going on out there. Different people are reacting to pressures that are out there about what parts of the economy to do when differently than we are. I'm trying to make the best decisions with public health that get the maximum number of people doing the very best to keep the virus down, and that is the entirety of my decision making. Whatever ramifications it has, whoever is upset afterwards, whatever it means for me, I can deal with all that. I know that lives are still on the line. I know that kids can catch this and people all throughout our society. I know that there are a ton of asymptomatic people out there, and I know that we lost more Kentuckians tonight. So every decision we make is to try to protect life. Morgan.
You spent a lot of time today stressing, and so did Dr. Stack, sort of the need to stay vigilant and keeping careful to avoid a second spike. But as Kentucky starts to reopen things this month, including retail and dining and at restaurants, every day you put up those 10 steps, and it includes, healthy at home, staying home, only going out for the essentials. Should people start to disregard that? I mean, what do you want people to do when it comes to that?
It's a good question. It's with all the opening up. I still show the rules of healthy at home, saying just stay at home. What's the message I'm trying to send to people? The message we're trying to send is healthy at home has worked. It has saved thousands of lives, and that's not because it was a great plan. It's because of what you, the citizens of Kentucky, were willing to do. You have saved lives, each and every one of you that has made good decisions is a hero. Healthy at work is a pretty intense set of guidelines too. And so if you can take that same commitment to healthy at home and put it to healthy at work, then we can start restarting our economy gradually and in a safe way and not have to pause it and not cause more spread of the virus. I keep showing the healthy at home because we got to keep remembering our number of contacts is how it spreads. It's person to person. The more people you're around and the longer that you're around them, the more opportunity this has to spread to you. It's almost a math game of both of those two factors. So knowing that just because we can do more doesn't mean we have to be really vigilant. And I would say the more people we go to work with and the longer we're there, the more we ought to just come home. Maybe the fewer, we can take advantage of a few of the other things that you can do. But don't go out there and do everything all at once. I mean, remember, you want to limit your contacts. So on the same day, don't go to a restaurant and get your hair done when you can. Though, Lord, I need a haircut, and I'm sure everybody else does. And just make sure that you spread it out. And remember, every day, even if you have almost a counter in your mind, how many contacts am I going through? How many have I seen? Every step we take that reopens is a risk, but I trust Kentuckians to keep it as low as possible. Shelby?
What phase of reopening will outdoor weddings and event venues fall into?
Outdoor weddings and event venues will likely fall into phase 3, depending on how an outdoor wedding could be done, and depending on how many people. I could certainly see that in July. Again, we got to do well in phases 1 and 2. If we see a spike in the nation, obviously everything is paused, and no one would want to go through with a wedding in July if the coronavirus was rapidly spreading and we were seeing more deaths. Outdoors certainly helps in everything that we're doing, and so that presents more opportunity. Now, I guess you have to be willing to deal with the heat in July, but it's certainly safer than being indoors for that. Again, those are special moments. I think my brother got married while it was in a church. It was in a church with no air conditioning in August. And my number one job as the best man was not to pass out. So we'll try to work with all these groups, because I know there's special moments that nobody wants to miss. Karen?
I know the movie theaters are in the plan coming up.
Mm-hmm.
Have you also gotten any plans from performance theaters like the Kentucky Center for the Arts, Lexington Opera House?
Right. So the question is, movie theaters are in here. What about other types of theaters and performances? That's another step that we need to take. The complicating factor above a movie theater are the people performing. And so we need to address that. If it could be done in a similar way, and they have some of the similar tools of the movie theater, then that's something we could probably deal with in a very similar fashion. And I will say that the movie theater proposal, for instance, talked about how with most people booking online, or how they're going to push them to book online, they can even spread out seats with I don't know if it's an algorithm, but if a family of 4 book seats, then they can create that area around them, and also that people aren't talking and not doing things that can otherwise spread, or they shouldn't be talking during a movie in that setting. So I'd be really interested to see the performing arts centers for that. We did get a proposal for an outdoor concert drive-in style at a drive-in theater, and that's something that we're going to be able to do, because with people staying in their cars, that's 6 feet away. That's a real opportunity. So I'd say for others out there this summer, for a lot of the entertainment, the drive-in style entertainment, if you can keep everybody in their cars, is pretty safe. So that's one good opportunity. Eleanor.
I spoke with several women with loved ones in Green River Correctional Facility, and I'm told one man was told to self-isolate, and that either he's been exposed to it, his cellmate has it, or he has it, but wasn't told whether he tested positive or not. Do you have any response to that?
It's a question about Green River, and I think it may be a question about whether inmates are being told if they are positive or negative, and I need to confirm that, because everybody ought to be told whether they're positive or they're negative. Now, they're all being moved right now, too. There is now a positive building. There is a negative building. There is a building for those that are negative but have been exposed, because it can take a little while to test positive. And then there's a medically fragile group, too. But nobody should have to know by looking around them which group that they're in. So if inmates have not been told, they will be told. And I appreciate the caller or the families bringing that to our attention. Morgan?
I got a couple questions people sent in, just kind of wanting, I guess, some extra clarification when it comes to the testing issue of, then people still being a little confused, if I don't have any symptoms, should I still go get tested? Does it depend on, what kind, who the provider is, whether it's open to everyone, that kind of thing?
You put all the testing up. So the question is about testing and about some confusion out there, because originally all across the nation there was a very limited amount of testing, and we were all really worried about this. Actually, I wish we were all still really worried about it. I think most of us are worried, but we need to be really vigilant about it. But now the testing capacity is dramatically increased. So we've gone from a place of having a limited amount of testing where those that are the sickest needed it, so we knew if they had this, to actually needing to test a large part of our population each month to know how much asymptomatic spread there is. That means how many people who aren't exhibiting symptoms but have it, and needing to be able to do the tracing and the quarantining for that. So on our website now, anybody who wants a test ought to go on and click on this, and it'll show you all of the counties and all the qualifications. Because we have so many different partners, there are different qualifications for different areas. Most of them now will accept anybody. And there is one, I believe, in every region that will accept anybody. And I would say if you're going back to work in the next couple of weeks, I'd recommend that you go get a test. I mean, none of us want to infect our coworkers. Now, obviously, you don't have to go back to work, but that's something that I would recommend just to make sure that you know where you are with it. There's going to be other checks, temperature checks, other things at work to help out, but that's a good step to take, and we really need it. We need, we want to get to a place where we're testing close to 50,000 individuals every week. We've got the capacity to do that. Now we got to create the way to get it done. But if we do that, we'll have a really good idea where we are week to week in this, not just in those that are symptomatic, but those that are asymptomatic. One last one, Shelby, we'll go.
We also get a lot of emails from daycare providers who are concerned and frustrated about reopening with reduced capacity. They don't want to turn away families, and they have insurance company payment problems. Do you have further guidance for them?
So the question is on daycares and concerns about reduced capacity when we're able to start. If we don't have reduced capacity, we will spike COVID cases in a very significant way. Virtually all states, and I think there's just a handful that don't, have significant capacity requirements where they're not doing what we're doing right now, which is just providing for a certain group of essential workers. Kids can't social distance in a daycare, and I think a lot of the daycare providers are worried about that, and rightfully so. So you can't keep them from passing their contacts to each other. The best you can do is limit the amount of those that go back and forth. Yeah, it's tough. It's difficult, and this is what the virus does. Now, a virus that preys on how many people we see on a given day and how many people we interact with and come in contact with challenges us in just about every phase of our society and in just about every support system that we have. We're going to work with them, but there's going to be no good answer. And there's no good answer to a lot of this. There's no good answer to the capacities at restaurants. There's no good answer on so many of the different pieces of it. The best answer is going to be a vaccine when we get it. And then we're going to have to vaccinate a large part of our population. And to those out there that are against vaccinations, it's going to create a real danger for that portion of the population. We're going to need people once we know it's safe. Once we know it's safe. And I get people are going to want to see it safe to make sure that we do what it takes to move beyond this. Karen?
Dr. Scott, there's so many reports now that everyone, of course, rushing to try to find the vaccine. Some say possibly September, some 12 to 8 months, if ever. In your expert opinion, are there any that you find more promising than any others?
Sure.
Yeah, so I'll answer the question about the vaccines and with talk about could there be one sooner. Look, I always hope that things will come sooner. If we get a treatment or we get a vaccine, obviously it's a game changer. I think I try very hard not to peddle in false hope, though. It takes a fair amount of time to create a vaccine and make sure it's safe so that when you give it to healthy people, remember, when you give a vaccine, you give it to healthy people. You don't want to cause harm with something you're trying to prevent harm. And so the vaccines are very, very safe. People can rely on them to prevent so many illnesses and avoid so much human suffering and death. I'm sure the scientists are going to work very hard to get it as quickly as they can, but hopefully not 1 minute before they are confident that what we use is safe. So, and as far as treatments, we have to wait and see. There's more hope that a treatment could come more quickly than a vaccine, I think.
So the one written question that I had from a couple of outlets is to respond to the court rulings from last night. Those are about in-person church services. First, my faith is critically important to me. It's a big part of my family life. We're not just in church when we can be every Sunday. My kids are there on Wednesday nights. I'm a deacon in our church. It's important to me, and I hope you've heard me talk about my faith in a way that you know that. And so we never set out to stop anything specific related to religion. We were just trying to save lives by stopping groups of people coming together for anything. So we had a couple courts rule that churches can start meeting for in-person services as early as tomorrow. I will tell you that courts in other states have ruled the opposite way. I think the Sixth Circuit judges had an impact on it here in Kentucky. Make sure that you are ready if you have church this Sunday. Make sure you followed all of these rules. And we were planning on getting this done and getting this done right in just a couple of weeks. And so for those that are more interested in court's wins and losses and might be celebrating, I really hope that these rulings don't have some groups going back faster than they should, not doing everything that needs to be done, and causing the spread of this virus. Since this has started, I've been done with politics. I'm not counting wins and losses. I'm counting number of lives and number of deaths that I have to read every day. And I hope that the actions of trying to speed this up by 2 weeks don't result in more people being lost. But to all of the organizations, all of our faith leaders that are out there, thank you for working with me. Thank you for sticking with me. Thank you for knowing we're just trying to do the right thing. And if I'm disappointed about one thing, it's that 2 total churches in this state took the attention away from over 7,000 other ones. 7,000 plus churches that sacrifice something that they care about, in-person services, for the good of their congregation. I believe that's noble. I believe that's living out faith, regardless of what faith it is, because it's been all different faiths. And I think that's the truly special story here. And I think that's the win that we ought to be celebrating. Eleanor.
There's a petition out there to reopen some pools. They say they can do it safely. Is that something that will be relooked at, or?
We'll look at anything that comes in. This is on pools, but again, socially distancing in a pool that is open to a community is incredibly difficult. And when we look at where things have spread that we know about, I mean, it's anytime you bring people in that proximity. Now, maybe we can look at lap pools. Maybe we can look at training facilities. There certainly, if we're looking at swim team, maybe we could look at the opportunity if there's a plan there. But just an open, let's all go to the pool is a real problem. And again, I mean, it's a worldwide health pandemic. Summer can't be the same. It just can't. I mean, we have people dying. We have a 1-year-old that came down with the coronavirus. So remember, if you're taking your kids to a pool, it's a good chance for them to catch it too. So let's just be careful. Let's not, just because it's summer or it's starting to be summer, let's not forget the time period that we're in.
Obviously with K-12 schools having had to close early, due to the pandemic, and some students not really having access to things like, good internet connections for online courses.
Yeah.
I've seen some stuff kind of nationwide talking about kids falling behind academically because of this, and I was wondering if that's something that, your education folks are looking at. How do you catch kids up when you do have school again, later this year?
Yeah. The question is on, the months, and thankfully it was just really months, that kids lost in-person classes this year. The fact that some kids can't participate at the same level at NTI, non-traditional instruction over a computer or else, as others. Are we worried that kids are falling behind? Are we looking at that? Yes. I was worried kids are falling behind before all this, but yes. It was what we have to do to protect. I mean, so many of these kids When there are some people who now think that we shouldn't have closed down schools, every kid that comes home to their grandparents, and a ton of them do, just think about that and the number of contacts and what it would have done. We would have seen significantly more death. In public health, when you have a bad flu outbreak, you close down schools for a certain period of time. And we had that in Kentucky even before this. So yes, we're worried about it. We're going to look at every opportunity that we have to make up for it. You know, we've asked our superintendents to make plans for everything because I desperately want to get our kids back to some type of normal school year in the fall. Does that mean if the virus is impacted by heat, maybe we look at going a little early, thinking if there's going to be a later spike, we can get in a period of time, and maybe that's when we help catch kids up. Could we look at a slightly longer school day? I'll leave that to them to work with that. Could we look at, if it stays steady, potentially a later date if we think it's closer to a vaccine? Yes, but it's impacting our kids, it's impacting our seniors, it's impacting our parents, it's impacted every single part of our lives. I mean, people want to get back to normal. We're living in a COVID world, and COVID sets the rules, and we try to adjust to them as well as we can. All right, so I want to thank everybody for everything that you are doing right now. Remember, we're in a critical time. Let's not let our success get to our head and make us believe that the battle is won. Yes, we are shifting, and we are shifting because of, in many ways, the phase of the battle we're in, from one of flattening the curve, which you have, to one of keeping it down and making sure there's not a new spike. How successful we are going forward, what our economy is going to look like 5 years from now, number of jobs out there, the amount of opportunity, the type of healthcare system we have, is all going to be based on how well we can transition to healthy at work. How we can do this without having to pause our economy again is going to be what separates those that surge ahead into what our new world will look like and those that fall behind. That's why we're trying to be smart, not the fastest, but the smartest, and ultimately doing this in a safe way. We're going to take off tomorrow. Happy Mother's Day to everybody out there, and we'll see you Monday at 5 p.m. Thank you all very much. No video, right? And we're done right on time.